Breaking into some special programming for a special news conference by Mayor Cranley.
That's right. We will hear from Cranley. We will also hear from Health Commissioner Melba Moore. They are talking about contact tracing, so we're going to listen in.
Thank you, Mayor Cranley, and good morning, Cincinnati. So, can I have the first slide up? Totally new cases for July 31st, we have 23. And we see with the currently new cases, large percentage of the numbers for today, 7 fall in the age range of 20 to 29, followed by 40 to 49 and 50 to 59 with 4 cases. Total confirmed cases is 3,942. Our median age is 36. Current hospitalizations, 64. With the largest number occurring among individuals 60 to 69, and that's a number of 18. Total hospitalizations, 460. We know that we're averaging about 11.7% is the hospital rate, and that's 2 hospitalizations within a 14-day period. Unfortunately, we have 77 deaths, and our case fatality rate is 2.0. Positive side, we have 2,002 individuals who have recovered from COVID. And the age range that we recognize where those recoveries are occurring is between 20 to 29, 30 to 39. And we look at our trends, we're having an average of 45 cases, total positive cases within a 14-day period, 1 hospitalization within that 14-day period, 0 deaths within that 14-day period, and 2 individuals are recovering average in a 14-day period. In total cases, we see that we have a high incident of cases in the Westwood area. But when we drill down to zip codes, zip code 45211, 45238, 45205, and 45204. Thank you.
Thank you, Commissioner Moore. I just want to add a little bit of good news. The mask mandate is working. 2 weeks ago, 3 weeks ago, when there was that spike that we all understandably got worried about and we're seeing around the country, the hospitalization average per day got as high as 4. And now today we're showing 0, but it's been, 1, but it's been bouncing between 1 and 2, and it's been trending down from 4 to 3 weeks ago. And so the mask mandate is working. And if you see what's happening around the country, it's still getting worse. Our numbers are coming down. Just you saw the chart a week or so ago, 10 days ago, we had 100 cases in one day. Today we're looking at 20-something, 40-something. I think our 14-day average of new cases a day is down into the 40s. A week ago is in the high 60s. And so the mask is working. Wear the mask. Next, we want to talk about the alcohol sale order that the governor and the Liquor Commission put in today. I want to make an important distinction that this order that was approved today by the Liquor Commission is not a health order. It's a Liquor Commission order. As a result, legally, unlike a lot of our orders that we're having our health department, Antonio and others from our health department enforce, this is a different animal. And so this will be enforced by the police. And so the order, as I understand it, is that liquor sales have to stop at 10 p.m. But the establishment themselves can stay open, and then liquor has to be off the table at 11 p.m. And so I've just asked the chief to come forward, and because there may be questions on how we would handle it if we see a violation. Candidly, we expect the Liquor Commission of the state of Ohio to do most of the enforcement. And if you're a bar or restaurant owner, be forewarned that there could be state liquor commission enforcers in your facility. And the governor has said he will be sending his people around to enforce. And we don't necessarily know that's going to happen in advance or not. But nonetheless, people can still call our police, and Chief Isaac is here to talk about that.
Thank you, Mayor Cranley. Just like in any of these orders, compliance is always the first goal. But since this is a order from the Liquor Commission, we will treat it the same way we treat other violations of liquor orders. Our officers will respond based on complaint. If they are found to be in violation, we will document that. We will pass that information on to the Ohio Investigative Unit, and it could potentially result in action against an establishment's liquor license. So we will treat it that way right now. Our officers will be available when we receive these complaints, as well as members of our vice control section. And when we're done, I'll answer any more questions that you might have.
Thank you. And later, we're going to be, or as we're doing this press conference and for public benefit, we are publishing or making readily available some of the contact tracing information we have about large gatherings and bars and nightclubs that have had high rates of violations for masks or overcrowding. And I just want to read this list of bars because this question comes up a lot. Is it safe to go to the banks? Is it safe to go over the Rhine? Where are overcrowding and failure to have masks being reported? And it is clearly overwhelmingly on the east side. The number one complaint has been at the Pirates Cove on Kellogg Avenue, followed by MLT's Mount Lookout Tavern in Mount Lookout Square, followed by Privileged in downtown, followed by Animations in Oakley, followed by Oak Tavern in Oakley, and then followed by Andy's Cafe. And so 4 of the top 5 are in Oakley, Hyde Park, and I guess that's the East End. So anyone who is going out know that these places have received a lot of complaints about overcrowding and masks. Along those lines, we get this data, and we're also publishing this data about large gatherings. And as I mentioned a week or two ago, that bars and nightclubs have been the largest source of large gatherings that people report who are positive, followed by family gatherings. And we have more data to release today that adds to the data we released 2 weeks ago, and the results are basically the same, that bars and nightclubs, and specifically the ones I just mentioned, are the top sources of large gatherings of people who are positive. It doesn't guarantee that's where they got it, but nonetheless. And we think the public is entitled to this information, followed by large private family gatherings. But all of that comes from our contact tracing efforts, which we started with and had as a wonderful health department committed to public health for over 100 years, and leading the nation as a city with a health department of that sort. But obviously, we haven't had a pandemic like this in a really long time. And so like everybody else, we are ramping up contact tracing capacity as quickly as we can. And we know it's not been perfect, but we are working every day to make it better and faster, to make it effective. And so to talk about those efforts, so where we've been and where we're going, Dr. Maurice Amin from our health department is going to talk about our contact tracing efforts.
Thank you, Mayor, and good morning, everyone. So I just wanted to talk a little bit about contact tracing. So we have our internal team, also with the Ohio Department of Health, have been outstanding throughout this whole process. We have had approximately 43 who have been working with us to do contact tracing. On Monday, we are going to have an additional 31 to supplement some of our previous staff who are working internally on this effort. So in total, between our internal staff, our ODH staff, and our new contract hires, we will have approximately 59 contact tracers working with us. What a contact tracer is doing is once we get notified of a positive case that lives in the city, we give them a call, we go through a series of questions. Those questions are asking about their symptoms, what their experience has been, and we also want to know who they have been in close contact with, because that's very important in identifying and reducing the risk of exposure and transmission in the community. Once we've identified their close contacts, we also reach out to them, have a discussion with them that they need to quarantine for 14 days. And we monitor their symptoms. We hope that people will stay asymptomatic, but if they become symptomatic, we refer them to their primary care provider to potentially seek testing. So this is all in the day of a contact tracer, and we urge individuals who do test positive for COVID-19 that they talk with us. And just so we can, help the whole process overall. Are there any questions?
Do you want to talk about how many we have, how many we're hiring, how many we're going to have next week?
Sure. Yep. So so our school health nurses have been outstanding in supporting this effort while they weren't in the schools. So they are going to be transitioning off. We had approximately 25 who were doing the contact tracing, which equaled a total of about 15 FTE, but they're going to be transitioning off. The 31 new hires are going to take their place, and they're going to be part of the team of 59.
So how do you can you do the 31 plus the other 20? So talk about how many we're going to have next week.
So 59 total will be next
59.
week. Yep. Mm-hmm. Absolutely. Great.
So I know we don't. Can we just keep questions again? Sorry, we were going where now.
Great.
Well, yeah, they'll be available for questions later.
Thank you.
Thank you, Dr. Amin. And just to repeat that a number of additional contact tracers are being hired next week. So we're not ramping down the capacity, we're ramping up the capacity. And we strive to get people results faster and faster as we get them. A couple other of items that I wanted to talk about today. One is that I think this is fairly obvious, but we want to be explicit. And it's sad, but given the history of this city, but this year has been, unfortunately, a year to not do a lot of great traditions, that we will not be having a Riverfest in Cincinnati. I think people know this already, but just to be 100% clear, we will not be permitting any gathering activities, beer sales, fireworks, gatherings on the river. The wonderful tradition of the fireworks will have to wait till 2021. And as obviously that's about a month away from now normally, we want people to plan accordingly. But it's inconceivable that we would feel comfortable to have that kind of a large gathering on the river a month from now, despite the fact that our numbers are getting better. No one thinks they'll get that great by then, or we'll have a vaccine by then. So we just wanted to be clear that the city will not be allowing Riverfest this year. Also, I wanted to just let everyone know that I've signed an executive order that is available to any and all schools that are in the city of Cincinnati, public or private. That the city is authorized to take immediate measures to promote safe and healthy operation of schools providing pre-K through 12 instruction. These measures include streamlining approvals for the installation of modular trailers, tents, and other temporary facilities so as to enhance schools' ability to implement social distancing measures for a safe learning environment for teachers and students. And so essentially what this means is if people are doing new space in a gym or in our rec centers or in a church or wherever they can find space, if and when they decide to do any kind of gathering of children together, that we will essentially waive fees and requirements in zoning and make it as easy as possible. And we want the schools to know that we are here to help. Similarly, as I think we previously published, but we'll say again, we have offered our rec centers free of charge to Cincinnati Public Schools if and when they want to try to get kids out of the home and into some learning environment. And we know that probably means more space, and we want to be crystal clear that we will waive permits, zonings, fees, and make free space available, and maybe that will be helpful. I think that's all the major issues we wanted to mention today. I'll be happy to open it up for questions. You had the question earlier?
Yeah, about the contact tracing. Are there things that you would like people to do that can make your job easier?
Yeah, I think if you test positive, you will be called by one, and you live in the city of Cincinnati, you'll be called by one of our contact tracers. And it's important to share this information. And to respond to the information. Your answers will be anonymous, right? Your name and number, all that won't be published. But what will allow us to do is to warn people about places of large gatherings where things have happened. And so getting that information and sharing it publicly, it just is an important thing to protect other people. You know, none of us would want to infect someone else. This is a highly contagious disease. You know, at some point, we may all get it. But when we do get it, we need to know that we have it as quickly as possible and to prevent other people from trying to get it. And so an individual can't obviously tell the whole world where they've been, but we can have these press conferences and we can publish this data about the kinds of places to avoid until the numbers, go down or a vaccine is here for everybody.
And with some of these bars on here that have had high rates, have you guys had a chance to talk to them directly, maybe talk about some of the issues they're having?
Antonio, maybe? Yeah.
Yes, we have had an opportunity to talk with these particular bars. As a matter of fact, the list was a result of complaints that we received. The ones that you see, the 6 are the most egregious complaints that we've received, as well as a high number of complaints, which involve social distancing and just general overcrowding. So that's how the list was actually devised. As far as a follow-up, the health department actually went out to those particular locations, provided education, and spoke with the management in terms of what the local ordinance is and to help them out in terms of, what the law is.
And also with the, I know symptoms can show up between 2 to 14 days after you've been exposed. What if people don't remember what they did like 10 days ago, or where they were exactly, or where they even got it?
Just answer it the best you can.
Yeah, so that's more of a contact tracing question. So I don't know if someone wants to.
So yeah, we just want, whatever information that people can provide to the best of their ability is really making a huge difference.
Okay.
As far as contact tracing goes, have you guys looked at models from, I guess, other cities or other places to see kind of what you guys may need or the resources that you need to make contact tracing efficient?
Sure, yes. So ODH guides us
Are pulling out of the mayor's news conference. A couple of different things came out of that.
Yeah, they talked about how mask wearing is working. They feel that it is keeping numbers in the Cincinnati area low. They were reporting a couple of those, good with hospitalizations, good with numbers that have been reported. They're also talking about contact tracing. That's what you're hearing about, some of those questions. How are people being contacted? When are they knowing? How do they go about letting them know where they've been heading forward? The other big announcement coming out of that is no Riverfest. So the big festival that we typically see along the Ohio River here in about a month is not going to be happening this year.
Yes, a couple of different things. Of course, we'll be covering it throughout the day for you. Our teams will have more coverage for you coming up at noon, 5, 6, 10, and 11 later on. But for now, we'll send you back to programming, and we'll see you at noon.